believe the question locally is directed towards the assisted living facility that we have that was originally designed as a P3, where the government built the building and a third-party group is in charge of operating it. I don't think that's what the public expectation was when that project was built. So our commitment would be to eliminate the use of P3s as a solution for the problem to begin with, and focus on government-provided services. We'd also, I mean, we could read from the party's platform. It outlines all of it there, but I think you're specifically referring to the Mountain View Centre and the fact that it hasn't met the needs of the local residents and their families that are presently there.
Okay, thank you, Mr. Manson. Mr. Campbell? Yep, this is Mr. Campbell.
Well, I think that, say, Linda and I have had a number of conversations about seniors and long-term care. And I think that one of the things that we are doing, well, first of all, we passed the Seniors Deferred Tax Credit, which allows seniors to live in their homes longer, which I think is very important. The second thing that we've done is that our funding will now follow the patient. So in the past, if you were in a DAL home and your health care or your health deteriorated, they'd move you to another facility. And so what we've done is that we are now going to allow the funding to follow the patient. So if you are at Good Sam's now, you'll stay at Good Sam's. We will just increase the funding and provide the health care that you need. We've also done away with all the titles, DAL, DSL, LT1, LT2, LT3, and we are just going to assess our seniors and provide the funding that we need. We'll also work towards bringing more home care workers into the province. To just say that we're going to hire 1,000 of them, that's nice to say, but the fact of the matter is it's to find them, it's to train them, and it's to get them out into our rural communities. There's no doubt that in rural Alberta we face some more difficult challenges than the cities do in recruiting healthcare workers to provide the services that we need for our loved ones.
Thank you, Mr. Campbell. Glenn?
Well, thank you for your question, Mrs. Johnson. Seniors care and the challenges that we have in looking after our seniors in this province is exactly one of the reasons why I stepped aside from being the mayor for Hinton to concentrate on what needs to happen in the province of Alberta. We have to start treating our seniors as more than a number, as a bed in a system. Our seniors need ways that they can live together in harmony and peace as they age and become infirm, and we've forgotten that seniors are people, and not just a number, not just a dollar on the balance sheet. So the Alberta Party position is, one, how can we keep seniors in their homes longer? And that's not just a public health care nurse that drops by once a week to fill out some paperwork and have a few words. Keeping a senior in their home longer involves such things as light housekeeping, mowing their lawns, shoveling their driveways, good meals, and how do we make that work so that couples can stay together longer as they age and become infirm. And then it's about how do we keep seniors together longer when they need a little extra care, such as moving into an assisted living facility. And it saddens me that your tax-paying dollars from your properties through your municipal grants go towards paying for things like the Evergreens Foundation and seniors' lodges. That's a responsibility of government of Alberta. And the government of Alberta should deliver on that responsibility. And the Alberta Party is committing to understand the continuum of health care. Health care isn't just about hospitals, and it's not just about seniors. It's about ensuring that we can live healthy lives through better nutrition and exercise, take more responsibility for remaining healthier longer, and then when we need care, ensuring that we've got the mechanisms in place to assure that the assistance that needed is there at the appropriate time. And so the Alberta Party is taking a holistic approach to healthcare in general, where seniors' care is available as needed when needed. And that begins with ensuring that we've got the proper workers in place in the proper place, and it's not in a privatized system. It's in a publicly delivered, publicly funded system with respect for our seniors. Thank you very much for the question, Mrs. Johnson.
Thank you, Glenn.